Take your temperature. Take off your old mask. Wash your hands. Get a new mask. And sign in. All of China's a nightmare now. And wash your hands one more time.
Shocking statements about the devastating effects of #coronavirus. 1,200 bodies cremated daily, 250 million people quarantined, 1.5 million people confirmed to have #coronavirus, 50,000 dead so far.
The 24 hours work, they burn the dead body. Every day is 1,200. They work more than 17 days. Only Wuhan, but now they is in the megapolis. It's a quarantine all of China. It's 250 million people. How many people really get confirmed case? And this outbreak. But this is the outbreak in half China, 200 million people. So I get inside information. Is the truth is 1 point. Outbreak in half China, 200 million people. So I get inside information. Is the truth is 1 point.
Well, you get the point.
5 million people is is the not only emotion, is the confirmed case. And the death of the people now is the burned body more than 50,000, not 30,000 as of now. In Wuhan, totally, it's the 49. The 24 hours work, they burn the death of the body. Every day is 1,200.
New video tonight of what China means by the wartime controls it's using to choke off the coronavirus. Soldiers enforcing the round-the-clock curfews in parts of Hubei province, the virus epicenter. Millions there confined to their homes, ready for door-to-door temperature checks. Food hung on doors to minimize contact. Tonight, we spoke to 3 Americans who chose to stay behind in Hubei, including Dr. Diana Adama.
Am I happy to stay? No, I think it's my duty to stay. I can help people.
The number of suspected cases shot up, 13,000 overnight. In total, around 60,000 now worldwide. At the World Health Organization in Geneva today, experts told us the profile of victims remains unchanged, with an estimated 2% fatality rate and the virus killing mostly the elderly, predominantly men, and many with pre-existing health conditions, especially smokers with respiratory illness. Do we have any sense of how big this iceberg is?
I think we have work to do to see just how big that iceberg is. But 78% of cases still have a direct link to Wuhan or to China.
NBC's Dr. John Torres is inside the CDC's war room in Atlanta.
They're looking at people that are quarantined and isolated here in the United States to make sure that their contacts are looked at and this disease doesn't spread any further than it already has.
Hundreds of Americans remain under federal quarantine. as the 15th case has been confirmed in Texas. Richard Engel, NBC.
San Antonio.
Pentagon expected to offer to host more coronavirus evacuees at 11 bases. Joint Base Pearl Harbor Hickam, Hawaii Great Lakes Training Center Navy Base, Illinois Naval Air Station Joint Reserve Base Fort Worth Texas Dobbins Air Reserve Base, Georgia Fort Hamilton New York Naval Base Kitsap, Washington Joint Base Anacostia Bolling, Washington, D.C. Joint Base McGuire-Dix Lakehurst, New Jersey Fort Custer Training Center, Michigan March Air Reserve Base and Travis Air Force Base, California.
I was so hopeful that once moved here, I shall be cured. But it is such a mess here. Patients everywhere. No isolation, no toilet, no medication. Please help. Please let the public know.
sources in Wuhan.
Once the doctors get sick, that adds another complication. Fewer people to help treat all the sick.
The virus has killed more than 600 people in China, including the doctor who warned of the outbreak before he was silenced by police.
When you work with
The doctor who warned of the outbreak before he was silenced by police. Including the doctor who warned of the outbreak before he was silenced by police.
When you work with population densities as high as we have in China, and then an outbreak that's spreading so rapidly, it's up to people around the world to get the help that's needed.
If you're here volunteering, you understand.
15th case of coronavirus in U.S. confirmed in Texas patient. The patient was a part of a group of people who were under a federal quarantine order at the JBSA Lackland base near San Antonio. U.S. military prepping for coronavirus pandemic. U.S. Northern Command is executing plans to prepare for a potential pandemic of the novel coronavirus, now called COVID-19, according to Navy and Marine Corps service-wide messages issued this week. An executive order issued by the Joint Staff and approved by Defense Secretary Mark Esper this month directed Northern Command and geographic competent commanders to initiate pandemic plans, which include ordering commanders to prepare for widespread outbreaks and confining service members with a history of travel to China. The Navy and Marine Corps messages, issued Tuesday and Wednesday, respectively, reference an executive order directing U.S. Northern Command to implement the Department of Defense Global Campaign Plan for Pandemic Influenza and Infectious Diseases 3551-13. The document serves as the Pentagon's blueprint for planning and preparing for widespread dispersion of influenza and previously unknown diseases. U.S. Northern Command said Wednesday it was directed the Joint Staff February 1st to commence prudent planning in their assigned role, synchronizing the department's plans for pandemic flu and disease. But in no way does the planning indicate a greater likelihood of an event developing. As military professionals, planning for a range of contingencies is something we owe the American people, Navy Lieutenant Commander Mike Hatfield said. We coordinate with other competent commands to assess potential impacts in the event of a pandemic, and we ensure the U.S. military is poised to respond as required, Hatfield said in a statement. The military profession fosters a culture of planning, and the fact that we are coordinating planning efforts across the geographical competent commands is consistent with how we prepare to respond, if directed.